Most Namibian men shy away from prostate cancer screening because the examination is done rectally. Prostate cancer starts as a tiny group of cancerous cells in the prostate, a tiny gland found right below the bladder in men, and can later develop into a full-blown tumor. Joining us now this morning to talk about prostate cancer is general practitioner Dr. Shayela Makemba. Doctor, good morning and welcome.
Thank you very much. Good morning. Thank you for having me, and good morning to our viewers at home across the nation.
Doctor, what is the main cause of prostate cancer?
Right. Prostate cancer, as we know it today, is probably the second commonest form of cancer, especially in the Western world, and the figure seems to suggest that the numbers are also on an increase in our setting. We see it quite commonly in men in the fifth decade of their life, that's men aged 50 years and older. The actual etiology or cause of prostate cancer seems not to be entirely clear. There are a few postulations and theories surrounding it, particularly with the issues of hormones that are steroid in nature, which is basically reproductive hormones in the male setting. But the exact cause is actually not entirely clear as yet.
All right. What are the different stages of prostate cancer?
Right. Prostate cancer basically is classified using what you call a TNM classification. By that, basically, we're talking about the tumor size, its location, and then, of course, the involvement of lymph nodes, and, of course, metastasis, which is basically spreading, beyond the prostate gland itself. Now, if you look at that and try to classify prostate cancer, then you are looking at 4 stages. Basically, stage 1, stage 2, 3, and 4. And stage 3 normally have stage 3A and 3B. Within stage 1 of prostate cancer, basically, that's when you have the tumor is basically confined to the prostate gland. At this stage, it's probably not easily picked up, even by medical imaging modalities that we have. Also, what happened in stage 1 is that the cells that are cancerous closely resemble the normal cells of the prostate, actually. And, of course, the proliferation or the growth of the cancer at this stage tend to be slow. Moving further to stage 2, then what then tend to happen is that the tumor then start to grow. You can easily pick it up if you do what you call a rectal examination. And the cells are then obviously abnormal. And also proliferation or growth of the cells seems to be quite rapid or quick within stage 2. Then moving on to stage 3, where you've got stage 3A and stage 3B. Basically what happened within stage 3 of prostate cancer is that the tumor is now a little bit grown in size. It's expanding beyond, what we call the gland, which is the prostate gland itself, particularly affecting the surrounding structures such as the seminal vesicles. And of course, lastly, stage 4, where there is what we call gross metastasis, where the spread can go to the bladder, to the rectum, can go to the bones, at times to the liver and the lungs as well. In a nutshell, that's the 4 stages of prostate cancer.
From what you've just explained, it seems that by the time you detect that a patient has prostate cancer, the probability of him being in stage 2 is quite high, because in stage 1, as you mentioned, it goes almost undetectable.
Yeah.
Is this not problematic in terms of trying to treat the patient?
Yeah, basically what happened then is that given the nature of the disease itself, as we have explained earlier, and the fact that sometimes the earlier stages are not as obvious, and also given the nature of men normally they don't tend to seek medical help on time. Okay, so most of the time when one is diagnosed with prostate cancer, chances are there that they have either progressed to at least stage 2, or perhaps in the early stages of stage 3. That's what happens most of the time. And even if you look into the literature, what normally the literature tend to describe stage 1 as an incidental finding, all right? Meaning that somebody walks into, a doctor's office, the doctor is perhaps, doing other tests. And if the doctor is probably proactive in terms of, screening their clients, also given the age factor, maybe advise a patient, depending on the age, to say, okay, at your age, it's probably advisable that we just make sure that you don't have a prostate issue. Then they start doing screens just to be sure. Then they can incidentally pick it up at the early stage. But most of the time, when it's picked up, it tends to be advanced.
What are some of the symptoms that men can look out for, when it comes to prostate cancer? What are the telltale signs?
Right. The symptoms of prostate cancer tend to be quite common in a sense that they are not entirely exclusive to prostate. They can happen with other conditions. But some of the few things that men can look out for at home is things like hematuria. Hematuria basically is somebody that is urinating bloody urine. Okay, that can be an indication that perhaps there's something brewing and they will have to be checked out for prostate cancer. Another thing that can happen is also what we call dysuria. Basically, dysuria is basically just talking about being uncomfortable when you are urinating. It being maybe it's burning when you are urinating, or it is painful when you are urinating. Now, depending also on how advanced the cancer is, sometimes, especially if the bladder is involved, men then tend to lose control of the function of the bladder. So you find a guy walking to your office, he's probably over the age of 50. He's a bit worried now because all of a sudden he just finds himself wetting himself and not even realizing that. That can also be a sign that there is a possibility of a prostate cancer going on. Another thing that can also happen is that, the flow of the stream, when a man is urinating, it can be strong, but now if you find the flow or the velocity of the stream of the urine is becoming a little bit poor, that can also be an indication that perhaps there's a possibility of a prostate cancer going somewhere. To an extent, you also find some men that they can tend to also develop what we call, once they have loss of bladder control, they tend to wear themselves. And then, of course, what that then can happen is that it can also cause what we call the urge to use the bathroom. Okay, it can be pronounced especially at night. A man comes into your office and say, I don't just understand, for the last couple of months or, years, seemingly that I'm just, having to wake up as often at night to go and use the bathroom. And then some patients also tend to have a problem with urinating in a sense that they go to the bathroom, they feel the nature is calling and they want to urinate, but then they stand there for a few minutes actually before the urine starts flowing. All right. Or some of them, they'll go to the bathroom, they start urinating, and as soon as they think they are done, when they're about to, just clean up and move out of the bathroom, then they realize there's still a flow or a drip that comes after. That also can be a sign that perhaps one is looking at a possibility of prostate cancer.
It's 2017. You would expect with the way that, medical technologies advance, that there would be a different way to be able to examine men when they, when you do the examination for prostate cancer. Because a lot of the time what puts them off from going for these tests is, as you mentioned, it's a rectal examination. Is there no other way to go about the testing?
Well, like you said, of course, the medical fraternity has advanced in terms of modalities that one can sort of engage in coming to a diagnosis of picking up the possibility of prostate cancer being present. Over and above the digital rectal examination, one can do what we call a prostate sonar. A prostate sonar is able to pick up whether the prostate is enlarged. And then, of course, once you do that, you can also draw blood. Blood, we do what we call a PSA, which is basically a prostate-specific antigen test. You draw blood, send it off to the laboratory, and then the laboratory revert back to you by reporting the figures. And then if it's elevated, then you then move on to do what we call a confirmatory test. A confirmatory test will then involve, of course, taking the patient into theater with the service of a urologist, and they do what we call a prostate biopsy. Then that biopsy is basically a piece that is taken from the prostate, sent off to the laboratory. And then what they do in the laboratory basically is that under histological analysis, they're able then to pick up whether there's what we call malignant cell, which is the presence of cancer or not, which then become confirmatory.
Fantastic. Doctor, any final remarks that you'd like to leave us with? Also, perhaps you can tell us what health activities men can partake in to sort of lessen their chances of getting prostate cancer.
All right. Health activities that one can partake in. Okay, let me try and be a little bit diplomatic in answering that one because that's quite an interesting question. Probably, your health is basically your greatest asset. Okay, and there's a saying that says that oftentimes people don't actually realize the value of their health until they become ill. Having said that, of course, there's not necessarily a specific activity that one can engage with respect to reducing the chances of course, getting prostate cancer. But like in any other setting, living a healthy lifestyle, okay, exercising, eating very well, these are just some of those things that tend to improve our health in general. And of course, prostate cancer is no exception to this.
Fantastic. Doctor, thank you so much for being here this morning.
Thank you very much.
That was Dr. Shayela Makemba, general practitioner, speaking to us this morning about prostate cancer.